Welcome, everybody. And today we are going to be talking about how to use telehealth to assist people who are in domestic abuse situations. And to cover this, I am interviewing Therese Hugg. She's the Vice President of Safety and Therapy Services at the Community Violence Intervention Center, which is CVIC. It's in Grand Forks, North Dakota. And Therese is a licensed professional counselor. She has 14 years of experience in the field of domestic and sexual violence. She oversees crisis shelters, stability, and therapy services that reaches more than 1,400 people a year. In her current role, she manages over 30 federal and other grants, totaling nearly $3 million to provide safety and healing services as a member of a statewide treatment collaborative for traumatized youth. CVIC serves as a catalyst, offering energy, momentum, and vision toward ending local violence. So they provide a lot of services related to domestic abuse, including training, direct service to those that are victims of domestic abuse, and services to abusers for treatment purposes. So Therese, thank you so much for joining us during this really important time. Right now, we're in the midst of COVID-19 and people are quarantined to their homes. They're not getting as many services. The abuse rates and just conflict at homes has really escalated. So yeah, I was wondering if you could kind of share with us, the services that you provide and how you guys are utilizing telehealth and what you've been seeing, in the field recently.
Sure. Thanks for having me, Raymond.
Yeah.
Well, we have kind of launched in when COVID happened, we had a speedy launch into our telehealth services. We'd started some training prior to that to use telehealth more with rural clients that we were serving. And then when COVID happened, that quickly became one of the few ways that we could connect with clients. We do offer our services on the crisis line and our advocacy services by phone as well. But then we added telehealth services to be able to meet with people who might need ongoing support and advocacy, or we also offer therapy services to victims of violence. So we were able to connect with them via telehealth at that time too. Mm-hmm. So it's been new, and we've encountered some barriers when it comes to domestic violence where, we do therapy with youth, and so that applies to domestic and other family violence as well, where the youth might not be residing in a home that's free from abuse, so they might not be able to engage in therapy because it's no longer safe to do that because the person who's abusing them is also living with them.
Right. Yeah, because if the abuser's on site, you don't have that safe environment where you can ensure that it's a safe environment.
Yeah.
I would imagine that gets really tricky. So I know one thing that clinicians do is they'll have the client, use the camera to show their whole space to make sure there's no one in there and to get a sense of the privacy of the location. But an abuser can obviously just walk as the camera's being moved to continually be out of sight while being in the room. Yeah. They could be monitoring the room in many different ways using technology. Right. I know that one of the recommendations, they say, when you're working with someone that's being abused, is you have to assess the abuser and the person being abused. And, you don't want them using any technology that the abuser has ever had access to or ever will, because they could obviously put a monitoring device on those devices. And
right.
Yeah, so I was wondering if you have, recommendations, like I tell people, you always want people with domestic abuse situations to see people that specialize in that, right? Because it's a very, very dangerous situation. Whenever someone reaches out for help with domestic abuse, it escalates the risk tremendously.
Right. And we really have worked with victims and encouraged our staff to connect with victims ahead of time before setting up Zoom, so that you have a thorough conversation around safety and what will work for them, and talking through all of those possible scenarios that to determine if telehealth or even phone counseling or support is appropriate for them during this time. We definitely work within an empowerment model, wanting to empower the people we work with to determine what's right for them. And they know their abuser best. And so talking through with them kind of what could happen, what they see as potential obstacles, potential safety concerns, coming up with, emergency protocols if something was to happen to them, if someone was to come home that weren't planned to be home during the conversation, how the advocate or the therapist would handle that, as well as the person that they're communicating with. So definitely important to have some thorough safety planning ahead of time before launching something like that with clients.
Yeah. I'm curious how you do that, because I personally had a couple situations like that. Yeah, we were helping a immigrant family, and one of the family members called us, and we suspected that someone was there, in the premises, and how to get notification of that secretly, and how to respond once you do know.
Right.
So sometimes we tell people, if someone walks into your space while you're in a session, just say, "Oh, hi, so and so," and then we'll know that someone walked in. We'll just disconnect from the call.
Right.
So that's one possibility. But yeah, any suggestions on how people handle those kind of things?
I think we've talked about coming up with passwords like that, or specific phrases that you would have with the person. That we also talk about having, if you and I were having a conversation, and someone walked in, having already a situational story kind of ready of who is it that I'm talking to, and if someone was coming in and we weren't able to end the phone call, to be able to talk about, I was on a work meeting with so-and-so from work, or and having some sort of reasonable explanation if that would work in the situation. But again, the person that you're working with would know if they're not working in an office setting where it's likely they would have telehealth meetings, it might not, that wouldn't be something that would be feasible for them to do.
Right. Yeah. Yeah. And in
And then
terms
go ahead.
Yeah, in terms of people's interest in how it is that they receive help from you, like, secure chat, or a phone call, or a video meeting, or coming to you on site for services. What have you seen in terms of people's preferences?
Well, typically people, and I mean, prior to February, March of this year, we didn't have telehealth as an option for our services.
You did not, or you did?
We did not.
You
so
did not. Okay,
we're kind of in a project this year where we're branching out to use telehealth. We're launching some online group support, and then we're looking at potentially doing some online chat options down the road. Currently, we are on Facebook, so we do have some people reaching out to us through Facebook or Instagram. We have people who call our crisis line typically, or you can walk into our office or call our office during the day too. One of the reasons we looked into telehealth services and more of the online services was to try to reach more rural individuals. And then we also wanted, we're feeling like we maybe are missing some younger generations who are more comfortable reaching out through technology versus picking up the phone and talking to somebody. So that's where we're wanting to explore some options around online groups and potentially some more online support down the road. We feel like we might have a little.
Right. Yeah, because the really important thing is to provide access, right?
Right.
And in a way that people are willing to receive it.
Yeah.
Yeah.
And I think during this crisis, it's been very helpful to have telehealth as an available option to just for clients to feel like they're still connected to that advocate or therapist, and be able to see them and feel like they're having a face-to-face meeting too.
Right. Now, what about the abuse shelters? I mean, that's vital. So
Yeah.
I imagine they're still open and people are still able to get the services that they need.
Correct. We do still. We don't have in-person services at our office, but our shelter do still. We still have people residing there, and if people were in need of shelter, we would help them access shelter either through us, or if they we're sick, our state has other shelter options available then. So definitely still a huge need, and that safety need doesn't go away just because of this crisis. So
Right. Yeah.
yeah.
Yeah. And sorry to go back, but I'm curious
No.
about the safety phrase or safety word.
Mm-hmm.
Um, you know, so like with passphrases, for security purposes, we usually put that passphrase in their chart, so we know
Oh.
what that particular person's passphrase is. So with their, safety word or phrase, it could
Mm-hmm.
be different for every client. So like if you get a call from a client, like, and they say that phrase that you've come up with in that scenario, how
Mm-hmm.
does the person that's working with that client know what that is? Would they have to say have that chart in front of them, or?
I think that would depend probably on the individual person that's working with them. A therapist would probably have that available in um, either in a soft file or in their file that they have for them. We typically don't have passwords like that for people accessing our crisis line, because then we'd have to keep,
Yeah.
like you said, keep tabs of what the password is between quite a few people on our staff.
Yeah.
But with someone you're working with ongoingly, they keep track of that, and then they can do that in their record or just kind of in their.
Uh-huh. Yeah. So they would have it somewhere on a file where they would know what
Right.
that, because if someone's saying the passphrase, if the abuser's on site, like it'd be so important that the clinician picks up on, oh, that's the safety phrase or whatever.
Yeah, and then end the call and be
Yeah,
done. Yeah.
that'd be vital.
Yeah.
Yeah. And does a clinician end the call, or what is that process like?
I think that again is determined individually between the two, what would work
Oh,
the best. And I know our clinicians are really concerned with safety and kind of have that on their forefront all the time. And, if there is a really high risk, they might choose not to do telehealth and just speak over the phone, where it's easier
mhm.
to end that and less chance of people tracking who they were talking to. Um, so I know they evaluate that with each of their clients.
Yeah. And
Yeah.
then verifying identity if you're just doing the phone call, because these are the
Mhm.
kind of situations that are so important with domestic abuse, is like if someone calls uh, pretending to be that person,
Mhm.
trying to get information or even find out, where things are, if they sought services. Uh, can you give us insight on how that's handled?
I don't know if we have a lot of situations where people are trying to pretend to be somebody else. Like I said, we have quite a large staff, so someone calling in for their therapist,
Mhm.
know their name, and then again, that's someone you have an established relationship where you know them.
Yeah.
Um, we are generally careful. We don't obviously release
You don't give out
information.
information to someone
Right.
asking information about someone else.
Yep. And
Yeah.
so a client would barely call in asking information about themselves. But
Right.
if someone calls in asking for information about any of our clients, we don't give that out unless we can
Yeah.
verify we have a release with them. And typically that would require us getting off the phone to verify that we have one, and
Hmm.
then calling the professional back office number. But
Yeah. Any
taking it at face
suggestions
value.
for like the clinicians who see clients that are they don't domestic abuse is not the symptom that they're coming to see the clinician for,
Right.
but then the clinician suspects that there's maybe abuse going on, and they're
Mm-hmm.
providing telehealth services to that client. Any recommendations?
I think to find out, if there is domestic violence going on, finding out about that, maybe not via telehealth conversation unless that's their only mode of therapy.
Hmm.
Um, but talking about safety in general can be helpful um, if you're not sure if anything is going on, or if something is happening, or if it's safe to talk about it. Even talking about who are your support systems that could help you with the symptom that we're talking about, even, and focusing on who are people you can reach out to if you need help or if you're in danger, and how are ways that you could reach out to me or as a clinician. And if you're not able to have a one-on-one conversation with that person and something that you consider 100% secure, talking more in general about safety and how to take care of yourself, listening to your gut and doing safety planning and talking about, here are these situations that can occur, and listening to your gut, because when something is wrong typically, and instead of doubting that, listening to that, so that if your gut's telling you you're in danger or that this is unsafe, then getting out of that situation and seeking help from supports, and trying to reframe it then in a way where that maybe fits with what symptoms are or what you're originally meeting with them for. And then if you have opportunity, having a one-on-one safe conversation around that, where you can do some safety planning that's more specific to potential risk.
Yeah, that makes sense. And we've given out the national domestic abuse hotline.
Yes.
Um, because we provide training nationwide, and a couple times we've had a couple people reach out to us. I think they have, because we have on our website a page with all sorts of crisis lines, emergency help lines.
Right.
And so I think they found us through that.
Okay.
So is that the best route, is providing with the national domestic abuse hotline number?
Absolutely. I think that way, anywhere you are in the country, you will get connected to a domestic violence center that's in your area, and so they can provide with resources that are closer to the people calling. So that would be great.
Okay, excellent. And then, I've been hearing that domestic abuse is escalated, and just people being not having the outlets for kind of getting away from your partner, and people irritating each other more and more, and so more domestic abuse going on. I was wondering, have you come across why that is, that domestic abuse is increased during this time with quarantine, or is it not? Is that just what I'm hearing?
I don't know if domestic violence is increasing overall. I think the severity can definitely increase when you have someone who's already using power and control in a relationship, and now there's this added virus that can be used as an element of control. There's also other restrictions to movement that can also be used as an added measure of control. Plus, you're then confined with somebody who's being abusive all the time. So there's limited access to reach out to. There's limited ways to reach out to resources for help, and there's added stressors, whether that's financial, just kind of always being together. So that can escalate the domestic violence as well. So I think there's a lot of factors there, and just knowing that people are even more isolated now, and isolation can be such a huge part of domestic violence.
So maybe do you think maybe with the isolation, the abuser feels more like they have more room to do abuse, because it might not be as likely to be found out, and then those being abused have less access to maybe getting help, or people finding out about it?
Potentially. I think domestic violence is such a issue of power and control, and where you have so much more power and control when you're able to isolate that person from other resources and from help. So that could definitely. Yeah.
And any recommendation for teens and kids, because that's it sounds like that's the population you work with most, right?
Yeah, I think we talk a lot about internally here too, reaching out to your neighbors and checking in on people that are, whether that's friends and family or people in your neighborhood, and just knowing that there might be people, teens, kids, adults, who are in need of help, and letting them know that you're here and you're seeing them. And definitely, if there are kids and teens who are experiencing abuse, if they're able to reach out to someone for help, whether that's through a teacher or counselor that they're doing online learning with, or a trusted family member, or a national hotline like you mentioned. So.
And some clinicians sometimes are unsure whether or not to report when they suspect abuse, of a child or adolescent, to the Department of Child Protective Services. in that region.
Mhm.
Any recommendations on how to make that judgment and what the best process is for that?
I think just knowing what your mandated reporter requirements are with the licensure that they have, and then I think talking it through with if they have a supervisor or a colleague that you can talk it through confidentially with to get some input, and then making your best judgment professionally and ethically that you can make to make that report. And
Mm-hmm.
um, so it
Yeah.
just would depend on what their licensure and their laws are in the state. But
Yeah. Well, say if they're not mandated,
mhm,
they're not mandated, but they suspect or they're
mhm,
curious about the level of abuse or if there is abuse going on.
mhm.
Is there any risks to jumping the gun and reporting to the Department of Child Protective Services? I mean,
Not sure. That would be probably a legal question, depending on what the confidentiality laws that
mm,
they have to follow.
yeah, I
Um,
mean on the client, on the client's end.
well, the client then could report if they have any suspicions of child abuse and
Yeah,
neglect. They could definitely reach out to child
yeah.
protection. And again, there might be legal things I don't know there, but
Uh-huh.
if people in good faith are reaching out saying they're suspecting that someone's being harmed, they might be protected by child protection laws. But what I've done in the past, if I'm unsure, is call CPS's intake line and you can talk through a situation hypothetically. And,
Mm,
I think you can definitely, as a citizen, call it the local child protective services and ask what the laws are and you know, what they would, how an individual would be protected if they had suspicions about a friend, a neighbor, or similar
yeah.
situations.
Okay. And then, I think it was Verizon, was giving away the cell phones
The
for
Hope
people
Line
in
phones that
domestic abuse. What's that?
the Hope Line phones that, or
Yeah, I think so. Where they'd be able to get a free cell phone, right?
okay, was that now recently?
No, it was a while back where I
Okay.
saw this. I don't know if they're still doing it because someone in an abusive situation often they'd want to use
Mhm.
it. They would want to use a phone that the abuser has never had access to and doesn't have
Yes.
access to make sure they didn't put on a monitoring app that's
Yeah.
actually not even visible by the user. Those kind of things. Is that used or any
We
thoughts
do
on that?
definitely use cell phones for clients. We used to get Hope Line phones from Verizon, and I don't think that we do anymore. But we sometimes do provide people with phones that have minutes, but then we also have some phones that we've gotten donated where we've deleted all the information and they're not even active, but you can still call 911 with them. So we
Okay.
do give out 911 phones to clients as well so that they have a separate phone that the abusive partner might not know about and that they can use then for 911 in an emergency, even if their abusive partner maybe broke their own cell phone, they could.
Yeah. Okay. Excellent. Yeah. Is there anything else that maybe we should cover about this?
Not that I can think of, but
All right. And so this is their website, CVIC, again in North Dakota. So if you are in North Dakota and you need assistance, either in domestic abuse or training or an abuser needing treatment, they provide all those services. And in terms of your training and resources, does that go beyond North Dakota?
we do, if someone calls in from out of state, we will always provide services, but we do typically provide training mainly in North Dakota. We have done some presentations nationally on our Safer Tomorrows Roadmap, which is our plan to end violence in our community in 2 generations. Um, so we have done some national presentations that way, but typically our training is in state.
Okay, excellent. Yeah, well, Therese, thank you so much. This has been very helpful.
Thank you very much for
Greatly
having me.
appreciate your help. Yes, and thank you very much for all the work that you and all the other staff that you're working with provide. Very, very important.
Thank you. It's
So
a privilege. So
thank you. Bye bye for now.
bye.